Well, I'm in the private sector, so when when lockdown started, hard lockdown in March last year, I made the decision that I'd work from home, and many of my patients were used to me sending them their results and prescriptions over a social media platform. So it was easy for me to transition to that, and then decide to stay at home and focus on other things. And then I went back to work, face to face in October, and that was quite challenging because people are still very afraid of going to see their medical doctors. So I had patients saying that they're not going to come in, even though they had to, because I checked their blood results and things were not okay, and because they were afraid of going out and catching corona. And this is a story for most practices, especially general practitioner practices like mine, where you rely on walk-ins. So a walk-in is a person that comes in with a flu or just a minor ailment, and they are the bulk of the patients that you see. So chronics are also quite important to keep a practice running, but without the walk-ins, without the flu, without people bringing in their children and so on, practices saw their finances going down, and quite a few practices had to close down, right? In terms of working online, like I did, doing stuff online, you can claim from medical aid, but obviously face-to-face pays more than an online consultation. So financially, it's been difficult. I had to make a few adjustments. Unfortunately, I have other jobs as well, but not every medical doctor has other jobs that they do. So some practices have had to close down. And I have a few friends who did carry on working all through lockdown, and they had to cut salaries, cut staff. So I had a friend who had 2 receptionists, and now she only has 1 until things pick up again. And we really underestimated the fear that people had of going out. So it's one thing, if you're sick, to stay at home and it's a minor ailment and you can treat it at home. But if you're sick, and you have to go and see a doctor, and you're telling me over WhatsApp that you're not going to go and see your doctor because you're afraid of catching COVID, I found myself having to be very rude to patients. I'm not a rude person, but I had to be stern and say to them, listen, if you don't go and see a doctor, then I'm not going to help you with whatever else you needed. And I don't like being like that, but I realize now in hindsight that people were so scared of leaving their houses, so scared.
And rightfully so.
Yeah.
You talk about the fear of people leaving their homes to even go for a checkup with a GP. What about your own fear? Because in many cases, when people are experiencing those first symptoms, you would be the first line of defense before those symptoms very likely turn into COVID-19.
Yeah, last week I had 2 patients come in, and they both had very severe flu-like symptoms. I sent them to casualty, and they both tested positive for COVID. And we have to keep on working, right? And the way I'm running my practice is that, I've spaced my patients out a lot. So a patient comes in, and then there's like 15 minutes between that patient and the next one, so I can air my room, spray, sanitize, wash everything down. But we have to continue. We have to continue working, and we need to continue helping people. And my plea for South Africans is that you can't default on your chronic medication. Yes, we are in a very scary time, but if we default on medication now, in 2 years or 3 years' time, we're going to feel the after effects of what's happening now. And you don't want to not be on medication, during a time like this. So it's hard. And the messaging that we have to keep getting out there is your chronic illness is important despite the pandemic. If you need to go for your checkup, you have to go for your checkup.
I'm just looking at my phone because I'm getting the number of healthcare workers that have been infected and have died in the public sector. You work in the private sector. But some 8,000 healthcare workers on the front line of the COVID-19 pandemic testing positive for COVID-19. This figure is from December. It says 91 people have died. I'm sure it's much, much higher than that. Have you, in your circle of medical practitioners, have you experienced any COVID-19 related deaths?
So I'm a member of the South African Medical Association, and we've lost quite a lot of members of the association. And so every other week, there's a lady that updates us on WhatsApp, sends us messages, and every other week there's a doctor that has passed away.
Sure.
So it's been quite harrowing because you know people from afar or you know them closer, but to watch the health sector go through this is quite harrowing.
And is there enough support for your colleagues who work in the public sector? Has there been? I've talked at the beginning of our interview about pandemic fatigue. We all feel it, but what we experience as people who just work on, for example, as journalists reporting on it, is so different, and is just, a sort of a minor experience compared to those who are on the front lines, and we have fatigue. What are the kinds of stories that you are hearing, And do you think that there is enough emotional support? I mean, support from the perspective of proper PPE, that's an ongoing discussion. But emotional support?
Well, okay, I'll take it in two parts. The first thing, Dr. Antoinette Mirich is a psychiatrist, and she set up a healthcare workers network that is providing emotional support for healthcare practitioners. So you can call in, there's a toll-free number, you can tell them how you're feeling, and they will help you. The other part is that because we're healthcare professionals, and there's just something about our training where you just have to keep on working, right? So even if you know that you're tired, even if you know that you're burnt out, you just keep on working. And the important thing is going to be for healthcare practitioners to realize that maybe they're burning out or not emotionally okay, and then get the help that they need.
Yep.
I think that thing that we're trained and where you just keep working despite the circumstances, this is not the time for this, because COVID-19 is nowhere near behind us, and we still have another year or two of this. So my plea is that if you're a healthcare worker and you can feel that you're burning out, get the help now so we can still use you in future. But if you burn out completely and you end up in hospital or end up taking leave, then we can't use you and you can't help people. So the getting help, the identifying that you need help, and the getting help will always be a challenge for healthcare workers because of the way that we're wired.
Yeah. I mean, Health Minister Dr. Zweli Mkhize yesterday even saying that the sector has lost so many healthcare workers as well. I want to talk to you about, as a doctor, how you've coped with your family life. You often tweet about your caramellos. I know you're also wearing a wonderful perfume, which I know is also part of your coping and self-care mechanism, but those are important things. And for healthcare workers who perhaps have been isolated from their families because they've been on the front lines, how does one, again, negotiate that part of your life?
Families of healthcare workers, they roll with the punches. You're used to not having your mommy around, you're used to her being on call and so on. I mean, I haven't been on call for a long time, but I know that most families just roll with the punches. You know that the person that you love and care about has to go out there and save lives. And they get used to that. They get used to that. In my case, because I was working from home, my kids, for the first time in their lives, had access to mommy all the time. And when I went back to work, they complained a lot and made me feel very guilty for going back to work. So we had to have a conversation, and I said to them, I spent more time with you this year than I've ever spent with you since you were born. So let's be grateful for the time that I was at home, and now I'm back at work and I have to work until we see what's going on. So it's been emotional, and also just being at home with your kids and your family all the time reveals a lot of dynamics. There's been a lot of relationship dynamic issues. My kids really, they stretched my mommyhood skills.
Yes,
and
yes. Also, have you heard the phrase "mommy" a million or so times over the past few months?
I have. And they were sleeping in our bed, which is also quite challenging. But I realized that they were just happy to have me around. It really has been the longest time they've ever spent with me in their lives since they were born. And it was special. But now I'm back at work and we'll see how it goes.
There are some positives. If we are going to look for the bright side of this awful pandemic, that would be the positive thing. That we're all hugging each other more tightly. We are enjoying our family time much, much more. Perhaps as someone in your position, someone who I know has a huge following on social media as well, people come to you for advice, not only women, but all sectors of society. What would be your advice, in the midst of the minister saying, this is going to be a pandemic that's with us for the next 2 to 3 years still? How do we go about navigating that 2 to 3 years?
I think the most important thing is to look after your mental health. I've done this. I did this last year. You need to tie up the loose ends in your life. So if there are people that you haven't forgiven, if there are people that don't know that you love them, if there are people that need to know that you're trying to repair a broken relationship and so on, this is the time to do it. And I did it last year. There are 2 people that I'd wronged and I hadn't spoken to in over 3 years, and I reached out and I fixed that. So if I was to die tomorrow, I die with a happy heart because I've tied up every loose end in my life. So I really encourage people to do that because nothing is guaranteed during this uncertain time.
Sure. We all need more grace during this time. Thank you so much for coming into studio. It's been a great pleasure talking to you. Dr. Sindi van Zyl is, if you haven't followed her on Twitter yet, has a huge following on social media. She is a medical doctor specializing in HIV and women's health issues. And that's as we continue to try to understand the impact of the COVID-19 pandemic.